Deciding what practice management system you will use in your small medical billing business can be challenging. Will you use the provider software? Will you use yours? Here's some ways to help you figure it out. Today is day 19 of our series, From Medical Biller to Billing Business Owner, Balancing Work and Entrepreneurship. And I'll be discussing medical billing software, that is practice management systems, and how to decide what will work for you. The software that you choose in your day-to-day work will influence how you operate and your efficiency. So let me break down the pros and cons of using the provider software or your own. But first, let me make sure that you know the difference between a EHR and a practice management system. Now, if you're already in billing, you probably do, or you might be a little bit confused. So a EHR is where the documentation is stored, where the medical records, the chart for the patient, where all of that is stored. A practice management system is usually used for billing purposes. It has the codes and diagnoses and payments and all of those things. Now, there are some systems that combine the two, I guess. But in the systems that I have worked in, you would need to have both the EHR and the practice management portion. But you just need to make sure that when you get a system, it is not just the documentation portion of it, that it is the practice management portion as well, and that you are able to bill out claims, post payments, and do all of that. Also, you want to make sure that when you are speaking to a provider, if you have decided to use their system, that you make sure that they have the practice management portion, and don't just assume that they do. There have been several times that I have dealt with a provider who thinks that they have the practice management side of it, but they don't. It's just their side where they document in the chart and, labs and all of those things. So just be clear when you're distinguishing the two. So we're going to go over the pros and cons for 4 specific areas. And the first being cost. Cost influences greatly what you decide to do. So if you decide to use the provider software, cost is not usually an issue because the provider has already bought the system. They probably are already using the system, and you don't have to put anything extra to the system. This is their system. They have taken on all the cost. So if you are starting your medical billing business and you are new at it, you don't maybe have a lot of money, then an option of using the provider software can be a good one for you. However, you may want to buy your own software, and with that comes fees and costs that you will need to put out of pocket for yourself. Now, initially, if you buy your own software, you're going to have to put out this cost, these fees in advance. So you might not have a provider already who can pay you and you can offset some of those costs. So you would have to put that out straight out. You would also have to make sure that the software that you choose is going to do what you want it to do for the cost that you're willing to pay. You might end up going with a practice management system that doesn't have all the bells and whistles that you want. So there can be pros and cons of both of those, but keep that in mind. Most startup medical billing businesses may start with using the provider's system, and then if they want to, they may go on to using their own system. Then there is the provider's familiarity with the software. So if you decide to use the provider's practice management system, they are most likely already familiar with it. They are familiar with it and their staff is familiar with it. So there is not going to be really any training or anything like that that you need to do. If you go with your own practice management system, then the provider's staff, the provider themselves, are not familiar with that system. For the most part, they probably aren't. And so you're going to have to train them, maybe have to, tell them how to use it, be able to install in their system. Now, I know there are a lot of billing companies that don't allow the practice to have access to the practice management system, especially if the practice management system is owned by the billing company. For me, that is something that I wouldn't want to do because I feel like the practice should have access to information like the patient's claims and what was sent out and how much was paid and how much the patient paid. I feel like the practice should have access to that. And for me, I use the client's practice management system so they can see that. But for those of you who don't want to use the client's practice management system, you have to decide whether or not you're going to give that provider access to the system. And if you do, you might have to train them, or you may not give them access to the system, and everything that they need to find out, they need to know, it will go through you. Now, working full-time and owning a medical billing business, you do not have the time to be answering the questions that someone who may be doing the billing full-time has. And so they can do that. So you got to keep in mind these little nuances that may happen. Then there are the features and functionality. So when it comes to using the provider system, you do not know what features or functionality that provider system have. If you are billing for 3 clients and you decide to use the provider system, you may have 3 different practice management systems that you have to learn. For the most part, you may have one of them that you like more than the rest. And you might think that one of them are limited in the features that they have, which is true. Currently, I use 3 different practice management systems, and of course, I like one better than the other, or there's something that I like to do better in one than in the other, because the features and the functionalities in these practice management systems are all different. So when you decide to use a provider's practice management system, you can decide maybe you will only use one type of practice management system. That is an option. Or if you're using different ones, that the features are going to be different and you're going to have to work with whatever feature that you have. Then if you decide to use your own practice management system, you can decide what features and functionality you want. Remember, you're the one who's going to be owning the practice management system, so you can decide which ones you want, what features you think are important and that you need, and you can choose a system that gives you more functionality and efficiency and what you want. So that's a good thing, or that's a pro that can be good when it comes to using your own system. We talked a little bit about training and competency, but we talked about it on the provider side. Now we're going to talk about it on your side. Are you good with computers? Do you know how to easily catch up with and deal with and navigate through all the different practice management systems? Because there are many out there. I have used Medisoft, Lighttech, Athena, Tebra, Practice Fusion. I have used so many systems. And in each one, there was a learning curve. I had to figure out what to do. And at the beginning, it can be difficult because you're accustomed to maybe using one system and now you're trying to have to figure out a next. I decided that I'm going to use the provider's practice management system because I think I'm pretty good when it comes to computers. But that doesn't mean that I still don't have a hard time sometimes doing certain things when it comes to using new systems. So deciding whether or not you're going to use the provider's practice management system will also come with learning that practice management system and learning different ones if you decide to do that. If you use your own practice management system, you will have to learn that practice management system, but you will not have to learn different ones, and you are able to master that practice management system. You know all the ins and outs. You learn everything that you have to do. So there are pros and cons in using the provider practice management system and in using your own. But remember, you don't have to stay in one set box. If you have started off using the provider's practice management system and now you prefer to use your own, you may be able to convince the provider to switch over, or when you get a new provider, you let that new provider use the new system that you got, and then from there, the new providers that you sign on, they continue to use your software. So you can play with the two of them and figure out which is best for you. I told you what is best for me, and I hope these tips help you to decide which one you want to do. I'll see you in my next video.